Story 1. There is a saying that if you do not want to explain to a nurse how it happened, you probably should not do it. That being said, if you do need to explain to a nurse how it happened, tell the truth because it is much harder to help if you lie. Story 2. The amount of people who stop taking medication and are surprised when the symptoms return, especially when it is their own child. Story 3. They truly believe that not being able to eat for 24 hours is unacceptable and will forego tests that could save their life or at least lead to successful treatment. Connected to this is the number of patients who confide in me that they ate before an operation but say, "Do not tell the doctor. I am going to tell the doctor." Story 4. Keeping their loved ones alive but with no quality of life because they feel guilty they did not spend enough time with them or do not want to make the call to change goals of care. It is worse if they refuse pain medication on the patient's behalf. Story 5. Somehow trying to threaten me by refusing treatment. You are the sick person, not me. Also, some people do not seem to understand that acting rude, belligerent, condescending, or violent will not result in better care. Story 6. I went into diabetic ketoacidosis last year, and I was very confused. I was fighting and losing bladder control. I became blind from high blood sugar and was placed in restraints. My husband told me how I was acting, and I desperately apologized to the nurses. I was met with empathy, and one nurse said, "Don't apologize, it was exciting." If I received that kind reaction from my thrashing rage, I can't imagine how severe it could get. I spent 8 months on the transplant floor, which was very quiet compared to the intensive care unit and emergency room. Story 7. Hey, my tooth hurts. No worries, tooth pain is very treatable. Take pain medicine, you'll be good in a week. 3 days pass. Hey, my tooth still hurts. It's only been 3 days instead of a week. I don't care, it hurts. Have you been taking pain medicine? No. I am upset that you are not helping me. You are not a good doctor. Story 8. The misconception that yelling at or being snarky with the healthcare team will improve your loved one's care is false. It will not. We will still take care of them, but no one wants to go the extra mile if a family member is recording or belittling them. Not telling the registered nurse in triage that you have a contagious illness and only casually mentioning it later is a common issue. Many people come to the emergency room for an unrelated complaint and after being roomed say, "I had COVID-19 2 days ago," or "I am being treated for shingles now." If you have a contagious disease, even if unrelated to your current complaint, we need to know so we can protect you and others. Being upset that there is no on-call dentist to remove your tooth at 3 a.m. is understandable because infected or cracked teeth can be very painful. However, dentists do not work in the emergency room. There are oral and maxillofacial doctors for facial trauma, but no one will be extracting impacted wisdom teeth in the emergency room. Lying about having chest pain to get a room faster will not work. You will receive vital signs monitoring and an electrocardiogram, but unless these are concerning, you will continue to wait like everyone else. Do not forget to use a flared base. Story 9. Being sexually inappropriate with younger female staff. Being racist toward staff of color. Being physically violent toward staff. Nurses bear the brunt of most of this. Story 10. Assuming that my answer to your question will change if you ask it again, usually louder and more aggressively to the point of being belligerent. Example, "Can I feed my mom?" "No, sorry, your mom is currently nothing by mouth for a procedure. She is receiving intravenous fluids for hydration. But she will die without food. So can I feed her?" "No, not right now." "Can I feed her though?" "My sister in Christ," I said no like 3 times. I explained myself. Please stop wasting my time and yelling at me for doing my job. Thank you. Also, people living in hoarder homes. The number of patients we have from hoarder houses is incredible, and I know it is not just my area since I have worked all over the province. I did not actually know it was that common until I started nursing. Story 11. How quickly arms become painted on. They came in for a chest infection and suddenly cannot wipe themselves or feed themselves. They quickly learn how to do these again once I ask whether they need to be evaluated for support at home, given they cannot complete basic activities of daily living. Story 12. Yelling at staff. Coming into the emergency room for self-treatable issues. such as throat pain while eating spicy snacks in triage. Calling emergency medical services for minor issues like a stubbed toe or tooth pain. Refusing to believe that drugs or tobacco are the root causes of their problems, such as severe vomiting related to marijuana use, chest pain caused by excessive vaping, or cardiac problems from methamphetamine use. Not picking up their antibiotics for diagnosed conditions and then demanding to know why they have not improved when they never obtained their medication for a urinary tract infection and now have a kidney infection. These are just a few examples. Story 13. I used to work in inpatient psychiatry and now work in the emergency room. I started noticing paranoid and delusional behavioral patterns that are shockingly common, but people walk around in normal society with these subclinical issues undiagnosed. Most diagnoses and involuntary holds only happen if individuals show these behaviors in front of the right people at the right time. Also, many people are completely unaware of their bodies and cannot distinguish normal from abnormal changes. For example, the tip of your toe turning black 1 month ago is not normal. That is why we are now consulting with surgery to see if we can save the rest of the foot. Story 14. I am an intensive care unit and recovery room nurse, and it is absolutely mind-blowing how many people live. Cockroaches in their home, continuous positive airway pressure machines, lice so severe they have to cancel the surgery because they keep contaminating the sterile field, toenails curled like talons, and skin folds that are macerated and breaking down. When you talk to the patient, they are kind and appropriate people with families. I think this is a huge sign of our lack of appropriate mental health care and health education in this country. Many people live neglecting their physical bodies, and it is very sad. Story 15. The number of people who will cough directly on you without attempting to cover their mouth or turn their head. Story 16. I work for a lawyer and demand to be seen now, to be given the medication I request, and to know the names of everyone who is working here. Story 17. The number of people who suddenly cannot lift their arm for you to put the blood pressure cuff on as soon as they are triaged is surprising. They might have an ankle injury, a sore throat, or some abdominal pain, but their arms are suddenly as useless as parts that serve no purpose. Story 18. Men making indecent advances and taking advantage of female staff aged 20 to 35, especially men aged 45 to 65. You mean to tell me if I walked into your emergency room bay with a full rack of ribs straight from the south, you could hold and eat them perfectly without issue, but you need help putting your penis in a urinal because you suddenly cannot, all because you have the flu? Stop it. Story 19. Family members approach you while you are in an emergent patient's room to request things. Someone once got angry with me for not getting their family member pain medication while I was with a stroke patient. Others try to ask for things while you are actively performing resuscitation on someone across the hall. Please have some situational awareness. If I am preparing epinephrine or ready to perform chest compressions, I am unavailable to grab another blanket. Story 20. I worked the front desk in triage at an emergency room and couldn't believe some of the reasons people came in. One woman said she was looking for a primary care doctor at midnight. I explained that this was an emergency room, not a primary care doctor's office. Many grown men with a cold or the flu acted like they were dying, which I found amusing. They often became upset about how long they had to wait since their situation was not a life or death emergency. Story 21. I worked in a hospital for about a year long ago, and two things come to mind. Some patients were communicating while sedated during minor operations. They did not remember anything and were not fully awake. But we had a girl who was literally speaking with staff during the operation. The will to live is a powerful thing. There were people who did not have major medical conditions, but you could still tell they would not leave the hospital alive. Story 22. Getting angry at you for giving them back their marinated vomit and puke-filled clothing you took off them 12 hours ago when they came in unresponsive. Story 23. What medical conditions do you have? Oh, I'm pretty healthy. I've never been to a hospital before. Okay. What medications do you take? I take lisinopril, Plavix, metformin, gabapentin, and sometimes Ambien. Something doesn't seem right. Story 24. Me. Do you use recreational drugs? Patient. No. Me. What about cocaine? When did you last use it? Patient. 3 days ago. Story 25. Emergency room doctor here. Board certified. practicing full-time in California. Mention this on Reddit and the cannabis enthusiasts will downvote you quickly, but marijuana does have a lot of side effects. One particular marijuana complication we have seen more of since legalization, which I support, is called cannabinoid hyperemesis syndrome. To put it simply, chronic users, especially heavier and daily users, are at increased risk of developing a syndrome characterized by severe abdominal pain and vomiting that is very resistant to intravenous nausea and pain medications. These patients receive multiple nausea medications and numerous doses of morphine or other narcotics but continue to have projectile vomiting and remain miserable. Over the years, we have found that the best treatment is an intramuscular shot of an antipsychotic medicine called haloperidol. Another effective treatment is the use of clinically formulated capsaicin cream, the active ingredient in peppers that produces heat, applied all over the abdomen. Neither treatment works well for other types of abdominal pain, but they are virtually the only effective options for cannabinoid hyperemesis syndrome. Unfortunately, the only real way to prevent episodes is to stop marijuana use. This is a difficult consequence for daily users, especially those who identify strongly with their marijuana use. Also, hallucinations and paranoia can occur after years of well-tolerated use. Story 26. Able-bodied adults of sound mind who soil themselves and then expect to be cleaned up to punish staff for not responding immediately when their call light goes off. I saw you walk in here. No, I will not wipe the urine off of you. Do you wet yourself at home? No? Here is a pack of wipes, a fresh gown, and fresh sheets. If you would like a shower, I can walk you down the hall. People, usually family members or visitors, who stand in the door or hallway glaring at staff because they have been waiting a while. Yes, you are waiting. Yes, this is an inefficient system, and there are many things I wish were different. Every year there are staff cuts, funding cuts, and we are expected to handle more patients than ever with less. But standing with your arms crossed, pouting at staff, does not make the hospital run faster. Threatening to leave as if it will get you better service. There are 20 people waiting for your bed if you do not want it. Sign this form and there is the door. Have a good day. Leaving against medical advice, then coming back to the hospital and throwing a temper tantrum when you have to start over again in the emergency room. No, we did not save your bed for you. You wanted to leave. If you have changed your mind, please get back in line. Story 27. I will watch them walk into the emergency room unassisted, without difficulty and talking. But as soon as I take them into the computed tomography room, they play possum and cannot walk, cannot move to the table, and cannot seem to talk to me coherently. People expect to be pampered and coddled in the emergency room. Lately, my most commonly used question is, how do you get around when you're not in the emergency room? Then people realize I know they are not being truthful. Story 28. Definitely yelling and becoming aggressive with staff if things are not going at the speed patients would like. Being allergic to basically all pain medications except the strongest ones. Homeless individuals using chest pain as a reason to have a place to sleep. Parents bringing their preteens or teenagers to the emergency department for psychiatric evaluations or crises, saying they will be right back and not returning. Bedbugs. Story 29. Getting upset when asked about allergies or medications saying, "It's in my chart. Just read that." Sir, your chart is a mess and shows you are on 5 different blood pressure medications, probably because the last few times you were here you said something like that as well. Let us confirm for your safety or make a list. Story 30. The number of patients who think it is on a first-come, first-served basis is incorrect. No, sir, your mother vomiting bile every 30 minutes with all vital signs at a normal level does not take precedence over the person we have identified as having a pulmonary embolism. Many people do not seem to realize that if we are not rushing you through, then that is a good thing. It means you are stable and not suffering from a life-threatening illness at this time. People who are seen by doctors before you are obviously more in need. Story 31. Substance dependency does not discriminate. It affects rich people, poor people, kind people, unkind people, people of all races and health statuses. Story 32. Some people with acquired brain injury present with symptoms very similar to an intoxicated person. You cannot assume someone is intoxicated with drugs or alcohol. Story 33. An alarming number of people come to the emergency room, refuse to provide any information about themselves or their reason for visiting, refuse any testing or treatment, and then discharge themselves against medical advice. Why did you come to the hospital, brother? Story 34. Well, I don't work in an emergency room, but I have been there a lot. I'm good at getting injured. No, I don't abuse going there. It's always a last resort. But I saw something crazy once that might fit. I was in the waiting area. It had already been over 30 minutes, but that was fine. I had injured my hand and wrist badly and needed to rule out a break. But I was able to wait just fine. There were other people in the waiting room, including one guy. I don't know what was wrong with him, but he didn't look sick or injured. Then a mom came in with a boy no older than 10. His entire lower leg was wrapped in bloody towels. He had cut open the front of his lower leg. Obviously, it needed stitches or at least getting cleaned to avoid infection. This was obviously more pressing to be assessed by the doctor than my injured wrist. But this guy, who looked and sounded fine and had been there a shorter time than me, started yelling that he had been there first and had waited at least an hour. I had been there a little over 30 minutes and I was there before him. He said it was unfair that they took the boy in before him. He needed to talk to a doctor, and there was a line. He still sulked after being told how an emergency room works. I was then called to get my hand and wrist looked at. My teacher, who brought me to the emergency room because I was a minor and away at school, said the man even sent us dirty looks. But by his standard, at least I was there first. Story 35. Many people lose the use of their hands in the hospital. Anecdotally, we notice it is worse in males, but it truly affects every demographic. Story 36. Saying they did nothing for me at XYZ hospital, but according to medical records, they performed every blood test possible: electrocardiogram, chest x-ray, computed tomography, angiogram, ultrasound, and more. What they mean is XYZ hospital did not find a clear diagnosis for the symptoms. People forget that the entire purpose of the emergency room is life-saving medical intervention and stabilization. The focus is not to find the diagnosis, but to determine if the cause of your symptoms is life-threatening within the next 24 hours. Story 37. I had a young girl come in and this is how it went. Me. What brings you here? Girl. I noticed blood on my toothbrush this morning. Me. Do you think you might have brushed your teeth too hard? Girl. No, but it could be from a bloody nose last night. Me. You had a bloody nose last night? Girl. No. Story 38. Aggressively masturbating at the staff. If I had a nickel for every time I have yelled, "Hey, stop masturbating," I would ride the merry-go-round for an hour. You put a quarter in the machine and the pony goes up, down, and around. Circular. Feel the flow. Story 39. I am not a doctor or a nurse, but I work in a hospital. I try to give people the benefit of the doubt because, after all, it is their emergency, not mine. However, people seem to overlook basic decency. If you cough, at least attempt to cover your mouth. It is not a good idea to walk around barefoot in the emergency department. I promise we will give you socks. If you have pink eye, please do not walk around touching everything, and stop rubbing your eyes. Story 40. Putting their deceased relatives in the car instead of calling for an ambulance. Paramedics and firefighters are much stronger than I am. I have to find a gurney and call for help, and by then we are starting CPR in the back seat. Not ideal. This happened about 6 months ago. I remember a family member telling me to get a gurney ready for his father because he had not been feeling well on a trip to Las Vegas. My hospital is based in Los Angeles. They drove for more than 4 hours to bring him back, and he just got worse. It took 3 of us to move his father from the car onto a gurney. My technician almost got hit by another car in the parking lot while we were handling this. I understand that people do not want to deal with a large ambulance bill, but that situation was very dangerous for my staff and ultimately for the patient. He was oxygen deprived for too long and had a poor outcome. Story 41. Requesting imaging without an evaluation because their chiropractor recommended it. If you want proper medical care, you need to allow me to provide it. I will not order a magnetic resonance imaging scan based on a questionable suggestion. Story 42. Public service announcement. Research the hospitals in your area. Not all hospitals are the same. Know what services they offer or do not offer and consider this when deciding where to go. This is particularly important for pediatrics. If you are a parent, please locate children's hospitals in your area and have a plan to go there if needed. Many hospitals do not have inpatient pediatric care or pediatric intensive care units. Check this information before you are in a stressful situation with a sick child. If you have just had surgery at a specific hospital and experience a complication, please return to the original hospital. A different hospital may not be able to view your records, and your surgeon likely does not have privileges there. In these cases, if you cannot be treated, you will be transferred, which can take multiple hours to days depending on transportation, weather, and bed availability. Obviously, this depends on location and situation. If someone is not breathing, go to the nearest emergency room. If you are in a rural area, you might not have many options. But please do some research and be thoughtful about where you go. Story 43. Radiographer at an emergency room. How long do I need to wait to see a doctor? I am sorry, I don't know. Then go and ask them. Patient waited for an hour, left the ambulance to feed his cat, returned 3 hours later, and is now ready to see a doctor. Paper cuts you cannot even see. People unable to move. An elderly man got scared when you transferred him to the computed tomography table. Because of that, he grabbed your back and chest. Drunk men on trolleys sitting up and urinating on the floor or all over the computed tomography scanner and table. I had to wait 2 hours for my x-rays. I am in pain. This is a disaster. In the room next to this, a young mother of 2 children was hit by a car, with bones protruding, blood everywhere, and deceased. I always offer to show them what a real emergency looks like. Be thankful that I do your ankle x-ray 5 minutes after seeing someone who lost their life with a husband crying next to her. If you can walk in normally, it is not broken. Story 44. My younger half-sibling is autistic. He ended up in the emergency room with a bad flu and a seizure incident. My mother couldn't leave his side for days because of the Americans with Disabilities Act issues. They had to sedate my sibling for an x-ray. Unfortunately, the x-ray technician woke him up while trying to position him properly. After that, we couldn't get my sibling to cooperate once he was awake. This is a typical experience for families with disabled members. My mother and my sibling moved to Europe and were amazed by how accommodating the local medical community was in their approach to patients with disabilities. For example, they had a dedicated nurse who scheduled all the appointments in one exam room in a single day. All the medical personnel came in and out while my sibling stayed in place. Story 45. In the elderly, urinary tract infections are often the root cause of altered mental states. My wife's experience in assisted living was that any time a resident showed signs of dementia, they performed a urine lab test first. She said it was about 75% of the time a urinary tract infection. Story 46. Calling an ambulance does not bring you to the front of the line. You will be assessed and wait in the waiting room like everyone else unless triage determines you need immediate attention. If you leave the waiting room and call emergency medical services from 2 blocks away, you will be returned to the waiting room where you were 15 minutes ago. Story 47. How many people use the emergency room as a dentist's office or walk in just for a pregnancy test? The test is the same as at a general store. Go there and leave me alone. Story 48. I was probably one of these people. I was very sick with my eating disorder and had to go to the emergency room. I sat and waited, and when called after my blood tests came in, they wanted multiple intravenous bags started immediately. As soon as I heard glucose, I panicked and tried to leave and refuse treatment because I thought I was fine. Doctors and nurses tried to explain that I was unwell, but I refused to listen and was generally difficult. I was put on a treatment order and treated anyway and was not allowed home for a while. Now that I am doing better, I realize I was not able to think clearly and wish I had acted better and made the hospital staff's job a little easier. Story 49. Cleaner in an emergency room. I work in a public healthcare system. I understand some of you come in with trauma, car accidents, or serious illnesses. However, you are often very messy. Disgustingly messy. Some rooms make me wonder what your house is like. People do some vile things in a hospital room and treat it like a dumping ground. Story 50. I'm not a doctor, but I just got out of the hospital after 5 days. The nurses and technicians were lovely and helpful. However, the rest of the patients and families on my side of the floor were terrible. The lady across the hall kept pushing the call button whenever she needed something, like a straw or a new pair of socks because these were too loose, or someone to figure out where the next episode of Duck Dynasty was on the television. The person in the room next to me literally called in his entire family to visit him so they could take turns trying to get the food staff to bring them meals for free. At one point on my last day, a very nice technician came into my room, shut the door, and when I asked what was wrong, she said, "I just need a few minutes away from those people, and you are the only nice one." That is awful. It is terrible that they treat these healthcare workers this way. They are just trying to do their jobs. I am not sure we will have medical staff in 10 years if this continues. Story 51. The number of people who take the path of least resistance and suffer from it is significant. Water on the bedside table and a physical therapist will ring for you to hand them the water when they are fully capable of doing it themselves. This issue worsens with long-term immobility and patients who come into the hospital mobile but leave needing a lift assist device. This situation ruins their lives and drastically increases the resources required to care for the patient. Keep moving, everyone. Move as much as you can. Story 52. Late to this post as usual, but I have family that seriously irritated me in the emergency room. Not long ago, I had my uncle taken to the emergency room. He was complaining of chest pain, already has a pacemaker and previous open heart surgery, so I took it very seriously. Once we were there, he became difficult. He complained constantly. He got upset every time staff walked out because they closed the door behind them. That's not them trying to upset you, uncle, that's respect. He complained because he wasn't rushed a warm blanket when he said, "I'm cold." Took a few minutes, but that was not acceptable. He was the top priority of the whole hospital when he arrived. He got mad because of the intravenous line placed into his wrist. I enjoyed it though. It took everything in me not to giggle watching his face. Well, this place is just terrible. They don't care to let someone lay here and suffer. They're not fast enough. They've forgotten me. I should just walk out of here and go home. I need to use the bathroom. How am I supposed to go use it when they have me hooked up to all this equipment? Go out there and tell them I need help. I'm about to complain and tell them what's what. Yes, uncle. This isn't a 5-star hotel or a fancy restaurant where people serve you. It's an emergency room. They are here to save your life. Testing takes time. You're not going to show them or put them in their place by being rude. In fact, these people have spent a great portion of their lives to be able to save yours, and you don't treat me that way, so why do it to them? I'm not qualified to save your life. I also don't deserve to be treated poorly. They are, and that's their job. Why do it to them? You're supposed to be very sick with how you were acting earlier, which is why we are here. And now, your biggest complaint is how long it's taking or that they don't cater to you. Please. Story 53. As a veterinarian and not a medical doctor trying to self-treat or asking any other medical professional, conditions that really should not be self-treated is concerning. Perhaps this is an American issue because of healthcare costs. I am not referring to deciding whether to go to urgent care for a fever. I mean, a client showed me a photo of his Fournier's gangrene during a veterinary appointment and asked if I thought he should see a doctor because Neosporin was not helping. He then asked if I could prescribe something for it. I told him, "You need to see a medical doctor." Story 54. I worked in a retail pharmacy, which was a little different, but people would leave the emergency room 10 to 15 minutes early and come in screaming about why their prescription was ready. I would look at the paperwork they threw at me, and either it was for a narcotic, which takes some time to prepare, or it was for an over-the-counter medication like omeprazole, and they would tell me I was wrong. Thankfully, we did not tolerate that behavior. If it got bad, we would call the hospital and direct them elsewhere or ask them to come inside and resolve the issue. I have zero sympathy for people who are mean to medical or retail staff. Story 55. Defecating themselves and smearing feces. Healthy, normal, physically capable, and mentally competent adults just soiling the bed and wiping with their hands. Story 56. Many people do not understand basic anatomy or wellness. The vagina is different from the urethra, and urine does not come out of the same opening. If you are constipated, go to a pharmacy, find the laxative aisle, purchase various products including enemas, and use them at home in privacy. This is more comfortable than having nurses assist or using a bedside commode. Also, if you have a fever, headache, or pain, try taking acetaminophen or ibuprofen, drink water, and wait. Spending $500 on medication or enemas is unnecessary. Story 57. Many people deny any medical history or issues. However, when you confirm that they do not take any medication, they start listing all the antihypertensive medications they take. You have high blood pressure. Your blood pressure is now controlled because of the medication. Also, seasonal allergies do not count when we ask about medication allergies. Story 58. Treating the emergency room as a fast-track primary care clinic. Expecting us to always have answers for vague medical complaints that have been bothering them for years, instead of understanding that the emergency room is actually meant to be used for acute emergencies, stabilizing patients, and ruling out life-threatening illnesses. Story 59. The number of admissions with abdominal pain of unknown origin who are pregnant and in labor. Denies sexual activity. Story 60. Former laboratory technician here. If your elderly relative starts acting paranoid, confused, or forgetful and turning off their internet for 3 days does not help, please take them to urgent care and request a urinalysis. Weird behaviors are a hallmark of a urinary tract infection in an older person, but they may have other pain or be on pain medication that blocks their ability to feel burning during urination or bladder, kidney, or flank pain. Often, erratic behavior is the only sign anyone notices in the early stages of a urinary tract infection. Story 61. Stopped the Mirror-LAX, and now she is experiencing anal leakage and large stools again. Why did you stop it? Because her stools were of normal consistency and did not cause pain. How long have her stools appeared normal to you? About a month. Before starting Mirror-LAX, how long was she having large, painful stools and anal leakage? Almost 3 years. When the problem returned, why didn't you resume the previous treatment? I don't know. How long do you think she needs to be on Mirror-LAX for this problem to not return? I don't know, or more commonly, she cannot be on it forever. She should be on it for about as long as she had the problem, approximately 3 years. Your pediatrician will guide you to slowly decrease the dose over a couple of months near the end of that period. However, she can be on it indefinitely if needed. Poor kid. Story 62. I'm coming from the emergency medical services side. Just because you are brought in by ambulance does not mean you will get a room faster. I cannot tell you how many people take an ambulance to the emergency room, arrive, and the charge nurse tells them to go to triage. Emergency medical services is not an instant room. Just because you decided to call us at 2 a.m. for your ingrown toenail, which you have had for 2 weeks, does not mean you will be treated before the person with obvious stroke symptoms. Story 63. 26 years later, I still feel horrible for telling off a nurse, but I kind of had a reason. I have given birth to 3 babies. I am one of the rare women whose labors were less than an hour. Of course, the doctor was not at the hospital when I started to crown. The nurse said I had to hold it in and wait for the doctor. Woman. The baby's head is literally coming out. I screamed profanities. I still feel really bad about it, but how did she expect me to hold it in? The doctor ran in 2 minutes later, barely having a chance to get in front of me. My daughter shot out of me so fast he had to catch her like it was a football. Yes, I had a doctor one time tell me that the way my body is made, I was born to have babies. Story 64. What have you taken for the pain? Nothing. You tried nothing at all before coming here? No. Me. You know why acetaminophen and ibuprofen are available over the counter? They are effective and inexpensive. Story 65. The number of people who suddenly become incontinent once they cross the hospital door threshold is too high. Also, many men suddenly cannot control urination into a urinal. That is unacceptable. Story 66. There are far more opioid-based addicts than you realize. Some do not know that they are hooked on oxycodone or similar substances. When they stop and experience gastrointestinal upset, they have no idea why. They are actually going through withdrawal without the substance in their system. Story 67. Slapping, punching, and spitting at the nurse, throwing food, sneaking in drugs and using them in the bathrooms, leaving against medical advice to use drugs and returning to the emergency room for their original problem. Story 68. Not a doctor, but I gave this advice to one of my sisters, who is a nurse. I simply told her that if a parent is refusing to give a child treatment like a vaccine, ask if they will subject the child to an allergy test. The idea is to see if the parents are willing to prove their justification for objecting to the vaccine. She gave it a try and found that a couple of parents were unclear about their beliefs regarding the child's health. She only had a few cases where refusal of vaccination was medically justified. I later learned that it was rather common for doctors to use psychological tactics to determine if they were dealing with a competent parent. Story 69. Tell the physician, who has over 25 years of learning and board-certified expertise, that they do not know what they are talking about. Story 70. How many men have gangrene in their scrotum or penis? Yes, women have gangrene in the vagina, but by far there are many more cases of penile wounds requiring vacuum-assisted closure. I once told a friend, after we saw our third case in a week in the intensive care unit, that if I won the lottery, there would be a billboard saying, "Men, please wash your genital area." Story 71. Only did a brief rotation in emergency. It was an experience but a limited one. From my short-term experience, continuing drug use while in the hospital is common. I understand dependency, but the number of people admitted for an overdose who then overdose in the hospital bathroom a few days later is staggering. The same goes for the loved ones of those admitted for an overdose. I worked with one patient who broke into a church for shelter and overdosed. They were revived and admitted to the hospital. That night, their spouse overdosed in the hospital bathroom. A visitor of the spouse went unconscious while visiting opioid overdose. The original patient was transferred to behavioral health and overdosed again less than a week later. All survived. I thought it was crazy, but it turns out it wasn't all that unusual. Story 72. Do you have any health problems? No, I am a very healthy person. Do you take any medications? Well, I take metformin for diabetes, rosuvastatin for cholesterol, amlodipine for blood pressure, and pregabalin for back pain. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.